my name is Kristen Okopian. I'm one of the occupational therapists here at Muskegon Surgical Associates. I work at the MSA Hand Center very closely with our hand surgeons, Dr. Ostrick and Dr. Terlouw. Today I'm going to talk to you a little bit about what to expect in therapy after you undergo an ulnar shortening osteotomy. Now, up to this point, I'm sure Dr. Ostrick or our PA have done a great job explaining to you what all goes into that procedure, but I'm just going to do a little bit of a review. What doc does this for is those people that have that pesky ulnar-sided or this side of your wrist pain that it cannot be alleviated any other way. He does shorten that bone. He cuts out a little bit of the ulna, that side of the forearm bone, and puts hardware in there, plate and screws, to create a union of that bone, and then it shortens so you don't have that pain anymore. However, because of the way that our anatomy is, the big thing that we have to worry about is that you're not rotating after this procedure. So our big job in therapy after you have this done, so we can make sure that you get the best result possible, is you come see myself or Amy, the other therapist, and we put you in a splint that looks like this. So what this does, as you sit in it like so, this comes up past the elbow so you cannot do a rotational movement. With doing this rotational movement, what it can do is it can disrupt the repair and the hardware that the surgeon puts in that area. So we want that to union the best we can so you can have the best functional outcome. Also, what we will do on that first visit is take some initial measurements, kind of get our baseline for some movements that we're allowed to do just to make sure you're not swollen, make sure that your pain level is tolerable. We will give you a few exercises to do. At this point, it's pretty limited, but we at least want fingers to get moving and we can do the wrist a little bit. But all of those questions will be answered when you come into therapy. Typically, because we're waiting for that bone to heal, we don't see you very much in therapy. Once we make you that big long arm splint, like I showed you before, we may see you once a week just to make sure that everything's fitting okay, that movement is still doing well. And then until doc gives us the go-ahead that the fracture site is healing, then what we will do is take this big splint and we cut it down to a forearm based. So then we can start to let you move and move at the elbow more, but still guarding movement so you heal properly. At that point, you will see us in therapy 1 to 2 times a week just to make sure everything is progressing as we want you to. If everything heals appropriately, the typical time frame, usually we will see people anywhere from 10 to 12 weeks. Like I said, depending on how you heal, everyone heals differently, so this could be at a different pace. If you have any concerns or questions for us in therapy, before you come see us for your first visit, please give us a call at 231-246-2440.